Malaysia is cancelling its primary school leaving examination. The major streaming exam PT3 for lower secondary school students also won't go ahead this year. The Education Ministry says secondary school and college leaving exams, as well as a major vocational exam, will be postponed until the first quarter of next year. Schools in Malaysia have been closed since the middle of last month because of a Covid-19 lockdown. More than 2,000 secondary schools in Malaysia have finally reopened today after being closed for almost 3 months due to Covid-19.
Like Viviana from rural Sabah. Her video went viral after she spent a night up on a tree in order to get good internet connection to sit for her exams. Now,
Assalamualaikum and a very good morning to everyone. Welcome to today's press conference titled The Impact of COVID-19 on Education in Malaysia. Over the next 15 minutes, we will be hearing from 3 speakers who will share their unique perspective on how the pandemic affected our education system, how we managed the crisis, and the way forward. First, we will hear from Puan Izzati, a teacher at SMK Shiraz, who will walk us through the early challenges school faced during the crisis. Then Dr. Zulaika, the Director of Health, will explain how the health sector worked to support safe schooling and communicate critical updates. Lastly, Dr. Nurhan, the Director of Nursing, will share solutions and future strategies to ensure our education system becomes stronger and more resilient. Without further delay, let's begin with Puan Izzati. Assalamualaikum and good morning to everyone. As a teacher at SMK Shiraz, I saw firsthand how COVID-19 shook the very foundation of our education system. When the Movement Control Order, which is MCO, was enforced in March 2020, schools were closed almost overnight. There was no warning, no proper plan, and certainly no digital infrastructure in place to support us. Suddenly, everything changed. We were told to shift to online learning immediately using Google Classroom, Zoom, Telegram, and even WhatsApp. Most of us had never even used these tools before, and we had to learn very fast. It wasn't just a switch in technology, it was a complete shift in mindset, in method, and in how we connected with our students. But the real struggle wasn't with the tools, it was with the reality of our students had to face. I had students sharing one phone with their siblings. Some had no internet at all, and others just disappeared from our virtual classrooms. Not because they didn't care, but because they simply couldn't be there. It wasn't about laziness, it was about inequality. That was the hardest part, seeing eager, bright students being held back by their environment, students who wanted to learn but didn't have the chance. And we as teachers, we felt helpless. Emotionally, the pressure was intense. We were managing our own families, trying to teach, and constantly adapting. We became more than just teachers. We were tech supports, motivators, therapies, all rolled into one. Every day felt like a new challenge, and with the school calendar changing so often, the uncertainty just kept growing. This pandemic didn't just disrupt lessons, it exposed every weakness in our system. The digital divide, the lack of access, and the fragile mental health support for students and teachers. It all became painfully clear. The learning gap grew wider, more students started to fall behind, and the risk of dropouts were badly increased. We were not only facing a health crisis, we were also facing an education crisis, a silent one, but just as serious. And every day, on the ground, we carried that weight with no clear end in sight. Yet, despite all of this, many of us kept going. Because we knew that education was not just about exams and grades. It was about hope, connection, and resilience.
Thank you, Puan Izzati. What we heard just now reflects the real and raw struggles on the ground. From the perspective of public health professionals, our greatest challenge during the COVID-19 pandemic was finding the delicate balance between safety and continuity, particularly within the education system. The Ministry of Health worked swiftly, often in the coordination with the Ministry of Education, to implement necessary standards operating procedures. SOP in the school, our goal was to reduce transmission while ensuring the learning could continue as safely as possible. Prioritizing vaccine for school communities, especially teachers and support staff, was a major step forward in creating safer and learning environments. However, if there is one area where we continuously struggle, it was communication. COVID-19 evolved rapidly, so did our understanding of the virus. With every new variant, surge or public health advisor, we had to revisit and revise our policies often at very short notice. School-related guidelines were among the most frequently updated. Unfortunately, this led to widespread confusion. Families were often caught off guard by abrupt announcement about school closure or reopening with little time to prepare or plan. What compounded the problem further was this disparity in access to information. In urban areas, digital platforms allow for fairly quick dissemination, but in rural and underserved communities, it was a different story. Limited internet coverage. Language barriers and poor digital literacy meant that some families never received official update or received them too late. This communication gap undermined trust and contribute to growing anxiety, especially among parents and educators. We also observed misinformation spreading rapidly, especially on social media platforms. In the absence of clear time update from trusted source, many turn to unverified channels, leading to confusion and at times fear. This experience taught us a crucial lesson. Effective crisis communication must be timely, decentralized, and community-focused. We need a multi-channel approach that includes not only digital media but also SMS alerts, local radio, community leaders, and school WhatsApp group, and even door-to-door outreach in high-risk area. Moving forward, we must invest in building a responsive communication infrastructure. We need trained communicators embedded within school and district office. We need simplified multilingual messaging tailored to different audience, and most importantly, we need to listen, because communication isn't just about spreading information, it's about ensuring it's understood, trusted, and acted upon. Well, in any further crisis, we cannot afford delays, confusion, or exclusion. Our communication must be rapid, transparent, inclusive, and above all, human. Thank you.
Thank you, Dr. Zulaika. I have always prioritized people health, recovery, and well-being as the Director of Nursing. Furthermore, I can state with confidence that COVID-19 recovery is not just medical, but also educational. Now is the time to look ahead and take proactive measures to ensure that our schools are safe, inclusive, and robust to any potential disturbance. Here's how. Number 1 is upgrade underprivileged communities' internet infrastructure. Secondly is increase the number of device support programs, which is all students ought to have access to educational resource. The third one is for people without connectivity, reinforce non-digital learning resource like radio and TV pendidikan. Number 4, establish mental health departments in school, complete with licensed counselors and support networks. And lastly, number 5, provide teachers with crisis response, trauma awareness, and blended learning training. Textbooks are only one aspect of education. It's about equity, mental health, and human connection. As a cohesive, prepared, and flexible system, we must assist our educators, learners, and parents.
What was the hardest part about online teaching in early days?
The emotional toll. Seeing eager students unable to attend class because of technology barriers was heartbreaking. It wasn't laziness, it was injustice. As teachers, we felt powerless.
How did you keep students engaged?
I tried to be more than a teacher. I was a friend and a motivator. I recorded voice messages, checked in individually, and praised small milestones. I learned that encouragement could go a long way, especially during chaos.
What would have helped you more during the crisis?
Emotional and technical support. We needed digital training, yes, but we more than that. We needed someone to ask how we were doing. Burnout was real, and mental health support for teachers is still lacking till this day.
What were the biggest communication failures?
Last minute changes. When case numbers spike, we had to respond immediately, but this led to confusion and panic. Going forward, we must improve clarity and timing in how we communicate.
How will things improve?
Well, we're building a task force to create clear, simplified, multilingual messages. We want every family, whether urban or rural, to receive information in real time and in their preferred language.
What lesson did you learn?
Well, health and education are independent. A school is more than a building, it's a public health institution too, and children can't thrive in unsafe or uncertain environments.
Question for Dr. Norhan. How did the pandemic impact children's emotional and psychological well-being from your observation?
We saw an increase in anxiety, withdrawal and even depression, especially in teenagers. Many lack structure and emotional support, and because mental health is still a taboo in some communities, it went unnoticed for too long.
Next question. What's one immediate solution schools can implement to support mental well-being?
For that question, every school should have a designated mental health local person, whether it's a counselor, training teacher, or visiting nurse. Even weekly check-ins with students can create a big impact.
What long-term investments are needed to make schools crisis resilient?
We need to invest in both hardware and hardware. Hardware means devices, connectivity, and safe infrastructure. Hardware means training teachers in empathy, trauma awareness, and crisis management. Both are equally vital. Let this crisis be our turning point, not just in how we teach, but in how we care. Let's rebuild a system where no student is left behind and no teacher stands alone. Thank you.